Time from Washington, D.C. is healthcare policy analyst for the Center for Public Policy Research, David Hogberg. David, welcome to the show.
Thanks for having me.
All right, David, of course, a lot of angst between the Senate, the Congress, shall I say, between the Congress and the White House these days. And it appears that this discussion on race relations out of Ferguson and now the news out of New York City, the White House appears to be using as a distraction from Obamacare and from immigration. Let's focus on your expertise, healthcare. What might we expect to see out of Republican Senate as it relates to Obamacare come January?
Well, I think maybe the best way to describe it is you'll see maybe a smattering of cooperation with the White House, you know, coupled with tons of conflict. Things like such as repealing the medical device tax, or perhaps you know, adjusting the employer mandate. Those are things that the White House has signaled it might cooperate on. But things like ending the insurer bailout or ending the individual mandate, you'll probably see those pushed by Republicans. They'll either get stalled in the Senate, or if somehow they get through the Senate, the White House will veto them. And should, you know, this case that is now before the Supreme Court, King versus Burwell, should that succeed, which means that everyone who's on a federal exchange is not eligible for a subsidy for their premiums, if that case succeeds, then, you know, really all bets are off, and you'll see Congress and the White House revisit the whole concept, the whole debate of health care reform again.
What is do you have a crystal ball on that? What do you expect to occur there in the decision?
I since the case on the individual mandate went the way I didn't expect it to, I try to shy away from predictions on that. I was kind of stunned when John Roberts upheld the individual mandate, so I really don't know how King versus Burwell is going to turn out.
Now, when you hear words like Jeb Bush spoke recently, you know, he may run for president, he may not. It looks like he's more than seriously considering it. Whether or not he wins the nomination, you know, time will tell. But when you hear a Jeb Bush say, look, Republicans ought to give up the idea of trying to repeal Obamacare and instead create an idea of an alternative, their own solution to our nation's health care situation. Do you agree? How do you feel when you hear a Republican presumed presidential candidate say such a thing?
Well, I think he's half right. Certainly coming up with their own free market alternative, which some Republicans have been doing, is a positive way to go. It you know, lets the public know, you know, what exactly are the Republicans' ideas on health care, and you know, hopefully would offer them something better than what we've got right now. But implementing those ideas is going to still require repealing at least parts of Obamacare. I mean, you can't really have a free market when people are forced to buy a product. You're going to have to repeal the individual mandate. You're going to have to repeal a number of the regulations, community rating, guaranteed issue, the employer mandate. A lot of Obamacare is going to have to be repealed. So for him to say that Republicans should give up on repeal, I mean, it's really not possible if you want to come up with a free market alternative. So, you know, he's either, you know, just doesn't know what he's talking about, or he's trying to score, you know, PR points, but that you know, for a practical standpoint, don't make a lot of sense.
And you mentioned PR points. I should mention, in the context of those comments, his broader point was that Republicans need to have the next candidate be more of a centrist and not steeped in ideology on the right. All right, David Hogberg, from healthcare policy analyst with the National Center for Public Policy Research. We thank you for joining us and weighing in on what will continue to be a contentious topic.